Mastering the gut, spinal blood supply. All nerves depend wholly upon the arterial system for their nutrition and the quality of their function, such as sensation, signal transmission, and motion, even though by the law of reciprocity they furnish force, nutrition, and sensation to the artery itself. Components of the neuroendoimmune supersystem control every cell in the body through a collaboration of the blood supply and nervous system. There are specific muscles requiring blood and nerves to maintain control of vertebral motion. These components play a role in the development of trapezius and occipital fibers. 3 spinal muscles: interspinalis, rotatories, and intertransversarii provide proprioceptive input to stabilize and monitor the control of vertebral movement. These 3 muscles are proprioceptive transducers, their value not lying in the force they can exert, but in the muscle spindles they contain. Precise muscle spindle input of the paraspinal muscles is essential for the accurate positioning of the pelvis and lumbosacral spine during activities of daily living. This requires an adequate blood flow to the spinal cord and vertebral muscles. We'll first look at the arterial blood supply and then move on to the venous drainage. With the arterial supply, essentially you have 2 sources which supply the spinal cord. There is one source which arises at the level of the medulla oblongata inside the cranial cavity and gives off branches which descend vertically down the length of the spinal cord. And you've also got vessels which feed in at different segmental levels, so these are segmental spinal arteries, or the feeder vessels, as they feed into each vertebral segment. We'll first take a look at the vertical vessels which run the length of the spinal cord. So looking at this graphic of the vertebral column, the spinal cord, and a few blood vessels, you can see the vertebral artery here coming off the subclavian on either side. And we'll just take a look at the right side, and you can see the vertebral artery rises up and passes through the transverse processes of the cervical vertebra. This vertebra here is C6, and the vertebral artery passes first through the transverse process via the transverse foramen and ascends up towards the cranial cavity. After entering the cranial cavity through the foramen magnum, the vertebral arteries anastomose to form the basilar artery, but what we're interested in is the vertebral arteries giving off the anterior spinal artery. This anastomosis coming off the vertebral arteries on either side, forming the anterior spinal artery. This artery runs down the entire length of the spinal cord, just anterior to the ventral median fissure, or the anterior median fissure as it's known. That's one of the vertical vessels. The other 2 vertical vessels of the spinal cord are the posterior spinal arteries. If we rotate this graphic around, we can look at the posterior aspect of the spinal cord. Posteriorly, you've got 2 branches given off from the vertebral arteries, which form the 2 posterior spinal arteries. These also run the length of the spinal cord, down the posterior lateral aspect of the spinal cord. You've got 1 anterior spinal artery and 2 posterior spinal arteries. So these are the 3 vertical arteries which originate in the cranial cavity and descend the length of the spinal cord. Now we'll take a look at the second arterial blood supply to the spinal cord. The second blood supply is from the segmental vessels, and they're called this because they feed into the spinal cord at each different segmental level. They enter via the intervertebral foramina, along with the spinal nerve roots. And these segmental vessels are given off by different blood vessels depending on the region of the spinal cord that they supply. In the cervical region, the vertebral and deep cervical arteries branch off into these segmental spinal arteries. And in the thoracic, the posterior intercostal arteries furnish these segmental arteries. And in the abdomen, the lumbar arteries give rise to the segmental arteries, supplying the spinal cord. For simplicity's sake, we'll take a look at just the thoracic spinal region and the segmental blood supply there. We're looking at the thoracic region of the spinal column, and you've watched the removal of the thoracic vertebra, exposing first the dura mater and then the spinal cord. You can see the thoracic aorta anteriorly with the spinal cord exposed, showing the dorsal and ventral roots attaching to the spinal cord. And then coming off the thoracic aorta, you've got the posterior intercostal artery. At the thoracic level, the segmental spinal artery is given off from the posterior intercostal artery. It divides into two branches. You've got the posterior radicular artery and the anterior radicular artery. And these follow along the dorsal and ventral nerve roots. You can see the anterior spinal artery running down in front of the ventral median fissure, and one of the posterior spinal arteries from this perspective running down the posterior lateral aspect of the spinal cord. At every vertebral level, you've got this arrangement of a segmental spinal artery giving rise to a posterior and anterior radicular artery. But at some vertebral levels, you've got another branch called the segmental medullary artery. This comes off the segmental spinal artery and directly joins to the descending vertical arteries, which are the anterior and posterior spinal arteries. This doesn't happen at every spinal level, but it's something to be aware of, and it acts as sort of a reinforcement of the blood supply that's provided by these vertical descending arteries. Also of note is that the largest segmental medullary artery is known as the arteria radicularis magna, which is essentially a descriptive Latin term for what I just said. So it just means the greater radicular artery. And this arises in the lower thoracic and upper lumbar regions, and it helps to essentially reinforce the blood supply to the distal parts of the spinal cord. That's the arterial supply to the spinal cord. Next, we'll talk about the venous drainage, and what I'd like to do is just switch over to a cross-sectional diagram just to explain the basic aspects of this system. We're now looking at a cross-sectional diagram of the spinal cord and its roots. Before the 18th century, the vertebral venous plexus received scant mention and had no clinical relevance and was largely ignored, most likely because of its location. The vertebral venous plexus is a unique, large capacitance, valveless, plexiform venous network in which flow is bidirectional, that plays an important role in the regulation of intracranial pressure with changes in posture and in venous outflow from the brain. In disease states, it provides a potential route for the spread of tumor, infection, and emboli. Batson's epidural venous plexus plays a crucial role for the generation of vascular back pain, in particular in those conditions characterized by venous congestion. such as pregnancy. Venous engorgement should be considered when patients have symptoms of back pain, because spinal cord hyperemia, compressing a nerve, can cause pain. Congestion in the vertebral veins may be a cause of low back pain and even be associated with organ dysfunction. In other words, your health is dependent upon every cell in your body receiving its nutrients from an unimpeded blood supply. When there is a loss of vasomotor control, it creates a great deal of congestion in our bodies. If there's resistance to the return of the blood to the heart via this mechanical pressure, blood will pool in the weakest area. The veins of the Battson's plexus are fighting for space amongst the many other structures in the spinal canal, and if swollen, the stretch on the associated nerves will be a pain generator. Just before we talk about the venous system, I'll draw on this diagram what we've just talked about. So posterolaterally, you've got the posterior spinal arteries, and anteriorly, in front of the ventral median fissure, or the anterior median fissure, you've got the anterior spinal artery. And then you've got the segmental arteries given off by the different arteries. So we talked about the thoracic level. So they were given off by the posterior intercostal arteries, the segmental arteries on either side, and the segmental spinal arteries divide into the posterior radicular arteries and the anterior radicular arteries. And then we also discussed that at some vertebral levels, you've got the segmental medullary artery directly given off from the segmental spinal arteries to join the vertical arteries. Essentially, you've got a similar structure to the venous drainage system of the spinal cord. You've got these longitudinal veins which run down the length of the spinal cord. You've got anterolateral and posterolateral veins which sit on either side of the dorsal and ventral nerve roots. Vasomotor fibers contain vasoconstrictor and vasodilator fibers. The fibers located on the occipital ridge, known as occipital fibers, have a pronounced effect on vasomotor action, in that the therapy applied to the occipital fibers balances the action of both the dilators and the constrictors. The vasomotor constrictors and dilators control the diameter of all arteries and capillaries, and by doing so have a powerful influence upon circulation. The control occipital fibers exert is very distinct upon the capillaries that supply the cells of the compensating spinal muscles and spinal cord circulation. Overconstriction endangers health by producing ischemia of spinal muscles and hyperemia of the cord and brain cells. Overdilation produces excessive fatigue and complete cell and brain starvation. A patient will enjoy life to a much greater extent with overconstriction than overdilation. Spinal health is directly dependent upon the spinal cord and spinal muscle blood circulation. This is dependent upon the arterial blood delivering oxygen and glucose and venous blood eliminating metabolic waste and carbon dioxide from the spinal cord and vertebral muscles controlling spinal movement and also for proper visceral function. The spinal muscle cells of the infraspinatus, rotatories, and intertransverse serrae receive the same source of nerve signals from the spinal cord that the viscera receive, and also have the same source of energy that the muscles of the skeletal framework receive. An engorged muscle cell means an engorged visceral cell. An ischemic muscle cell means an anemic visceral cell. Hyperemia of the spinal cord cell bundles cause ischemia of the spinal muscle cells. The resultant spinal cord engorgement is responsible for further increased functional and organic activity due to an excess of blood in the cord cells. This increases all activities due to vasoconstriction predomination. The increased activity after a time causes deterioration of the patient's health and vitality. All organs innervated from the hyperemic cord cells are in a state of ischemia due to the excessive hyperemia causing abnormal stimulation of the vasoconstrictors. Any diseased organ will be found to be constricted and its cells in a state of starvation. Ischemia of the spinal cord cells causes hyperemia of the corresponding spinal muscle cells. This spinal cord cell ischemia causes the cord cell to have too little stimuli, and therefore all organs innervated from the ischemic segment will be found to be in a state of dilation. The patient, after a time, becomes weak and very easily fatigued. The lack of energy becomes very noticeable. If an infective bacteria attacks any organ, the engorgement already present will offer a fertile breeding field with the resulting stage of severe inflammatory reactions occurring.